What to know if you have diabetes. What to know about diabetic foot care and how to prevent foot or toe amputation.
This is not any kind of medical advice. So please see your healthcare provider or your physician for any concerns with your diabetes. So have you heard of people who've had an amputation of their foot or toes because of diabetes? Well, I'm here to talk about some things you can do to prevent having your toe or toes or your foot amputated as a result of diabetes. So let's dive in. So first, let's talk about diabetes. Lots of people don't understand what it is. So diabetes is very simple. It's a condition of excess blood sugar. And why does this happen? It occurs for many reasons. It's something someone is born with, they're born without the insulin, or it's something they acquire. So as they get older, they either have a lot of weight on them and the insulin that the pancreas makes is not enough, or they're just not making enough, or the insulin is not effective. And so diabetes is a very common condition that we see as people get older. There are some risk factors like obesity, excess calories, family history, lack of activity, medications, and just so many other things. So when you have people who've been diagnosed with diabetes, sometimes they are so scared. And the first fear that they have is that they're going to lose their toe or their toes or have their foot amputated. And this is a big fear for people who have diabetes, and they don't understand why that happens. So today I'm going to explain how this amputation of the toe or toes or foot occurs. So I'm going to refer to this as amputation. So as the video continues, you're going to hear amputation, and that's what I'm referring to. So what does diabetes do? Let's try to understand what diabetes does and how it affects the foot. So when the blood sugar is excessively high, that elevation in blood sugar actually damages the nerves, and those nerves become deadened, so those nerves cannot feel. And so if someone has diabetes for a long time, they will have numbness in their feet. And this numbness does not allow them to identify any ulcers or sores on time. And those sores may get infected and not get treated because they don't realize there's an ulcer on their foot because they cannot feel because the nerves are dead. So high sugar affects the nerves, and that high sugar affects the nerves in the feet. And the nerves in the feet, when they don't work, a person can get a little scratch and not notice it, and it gets worse. And then it becomes an infection, and they don't notice the infection because maybe that ulcer is underneath, on the bottom of their foot, and they just can't see it. So very important to control and prevent this condition from happening is to be mindful of the blood sugar reading. So your doctor provider will tell you what your readings should be. Your doctor provider will also tell you the goal of treatment, so what your A1C should be. So the A1C is a measure of the blood sugar control for the past 6 weeks prior. And so your doctor will give you these numbers, will tell you what your goals of treatment are. So if you can get your sugars to the normal range, you may not have a foot ulcer that you will not feel because your nerves will be working well. Now, it's very important when you're diabetic, you have to check your feet every day. Do a daily inspection of your feet. Also, check in between your toes because sometimes people who have diabetes, because the blood sugar is so high, they are predisposed to fungal infections. So check in between your toes for any signs of wetness of the skin in between your toes. Unchecked, that wetness can lead to fungal infection. And that fungal infection can allow bacteria to go inside the skin of the foot. So this is important to check. Make sure you dry your feet after you take a shower. So the purpose of this video is for health education content only. It is not medical advice. For fungal infections of the feet, you can buy over-the-counter medications. You can speak to the pharmacist and they can tell you what to apply. If you're diabetic, invest in some good footwear. Make sure it is not too tight or too loose. When the footwear is too tight, it can predispose to pressure sores. And if your nerves are not working properly, it can cause you to ignore those those pressure sores, and that pressure sore can become an ulcer, which is a break in the skin, which can lead to infection in the foot. And if that infection is not treated, it can result in surgical intervention. So in summary, daily foot inspection is essential. Avoid wearing tight shoes. If you are diabetic, you need to ensure that you see a foot specialist. A foot specialist is a podiatrist. They specialize in conditions of the feet. That visit is usually a routine visit once a year, and if there is a problem, the foot doctor will let you know what to look out for. If you have been diagnosed with diabetes, there's no need to be afraid. There are good medications to treat diabetes and control your blood sugar. Lifestyle is very important. You want to make sure that you've spoken to a nutritionist or a dietitian who can advise you on how best to eat. If you're on medications, take your medications regularly. Set your phone timer to remind you to take your medications. If you're on insulin, take your insulin regularly. Monitor your blood sugar as directed by your provider. If you have diabetic pills that you take, most people don't need to check their blood sugars every day. Some people might check their blood sugars once or twice a week, but check with your healthcare provider to tell you what is best for you. Diabetes is a very common condition. There is no need to be afraid of the diagnosis of diabetes. When some people are diagnosed with diabetes, they go into denial and they delay their care. That delay in care causes the disease to get worse. When blood sugar is high, the body's functions don't work properly. For instance, your white cells that fight infection don't work properly. And like mentioned, the nerves start to deaden and you don't feel things properly. And that's where people have an ulcer in their foot and they miss that ulcer because they're not paying attention. So have it in your routine to check your feet every day. And if you see any red areas or areas that look scratched or wet areas of skin, see your doctor so that you can prevent problem and infection with your foot that can lead to amputation. Thank you so much for listening. Please like, share, subscribe, and see you in the next video.